Good God, how does she even fit through the door? Sneered Dr. Richard Hamilton, the chief of surgery, as I walked past the doctor's lounge at St. Mary's Hospital. I swear that nurse gets fatter every month. How can we expect patients to trust medical advice from someone who clearly can't control her own eating? She's a walking advertisement for poor health choices. His colleagues erupted in cruel laughter, making pig noises and joking about how much food I must consume to maintain my 280-pound frame. What these arrogant physicians didn't know was that the fat nurse they mocked daily was Margaret Rose O'Brien, a registered nurse with 15 years of experience, a photographic memory for drug interactions, and the clinical skills that would save Dr. Hamilton's life during a massive heart attack just 3 weeks later. Sometimes the people you judge most harshly become the angels who rescue you from your darkest moments. My name is Margaret O'Brien, and this is the story of how being obese in a medical profession that prized appearance over competence taught me that worth is measured by character and skill, not by the number on a scale. In 1974, I was 42 years old and weighed 280 pounds in a culture that viewed fat people as lazy, undisciplined, and morally deficient. Working as a nurse in one of Chicago's most prestigious hospitals meant facing daily humiliation from colleagues who assumed my weight reflected incompetence, rather than the complex medical and genetic factors that had shaped my body since childhood. Growing up as an overweight child in Irish Catholic Boston during the 1940s meant learning early that society judges people by their appearance rather than their hearts. My mother, Bridget O'Brien, was a seamstress who struggled with her own weight while raising 6 children on a factory worker's salary. "Maggie, love, the world will try to make you feel ashamed of your body," she would tell me during the hard times when cruel children made me cry. "But God made you with a gentle soul and healing hands. Don't let anyone convince you that you're worth less because you carry more weight than they think you should." The decision to become a nurse, despite the physical challenges and social stigma, was both a calling and an act of defiance against a society that assumed fat people were too lazy or stupid for demanding careers. Margaret, nursing is a physically demanding profession. The admissions counselor at Boston College had warned me in 1957. "Are you sure you can handle the long hours, the lifting, and the constant movement that the job requires? Perhaps you should consider a desk job that would be more suitable for someone of your size." But I had always known that helping sick people was my purpose in life, and no amount of discrimination or doubt from others could change that fundamental truth about who I was meant to be. The nursing program was challenging but rewarding, as I discovered that my size actually provided advantages in some situations. Patients found me comforting and non-threatening, and my strength allowed me to assist with lifting and moving patients in ways that smaller nurses couldn't manage. The early years of my nursing career in Boston hospitals had been difficult, but educational, as I learned to navigate workplace discrimination while developing the clinical expertise that would define my professional identity. "O'Brien may be fat, but she knows her stuff," was the grudging acknowledgement I received from supervising physicians who couldn't deny my competence despite their prejudices about my appearance. The move to Chicago and St. Mary's Hospital in 1971 had represented both a professional opportunity and a personal fresh start, as I hoped that a prestigious medical center would value clinical skills over superficial judgments about weight and appearance. "We need experienced nurses who can handle complex cases and work well under pressure," the head of nursing had told me during my interview. "Your references speak very highly of your knowledge and dedication." But the reality of working at St. Mary's was more difficult than I had anticipated, as the hospital's culture of prestige and perfectionism extended to expectations about staff appearance that went far beyond professional dress codes. The physicians, particularly the surgeons, seemed to view my weight as a personal failing that reflected poorly on their department and the hospital's reputation. "Patients come here expecting to see medical professionals who look like they practice what they preach," Dr. Hamilton had explained during one of his lectures to the nursing staff. "How can we counsel patients about healthy lifestyle choices when our own staff includes people who obviously don't follow medical advice about diet and exercise? We need to maintain standards that reflect the excellence of our medical care." His not-so-subtle references to my weight were part of a pattern of harassment and discrimination that made every shift an exercise in enduring humiliation while focusing on patient care. The comments about my size, the jokes about my food consumption, and the assumptions about my fitness for duty created a hostile work environment that tested my resilience daily. The expertise I had developed over 15 years of nursing practice was both my shield and my sword in battles against colleagues who judged me by appearance rather than performance. My knowledge of pharmacology was encyclopedic, my diagnostic skills were sharp, and my ability to remain calm during medical emergencies had earned grudging respect from some physicians who worked with me regularly. "O'Brien knows more about drug interactions than half the residents," admitted Dr. Sarah Martinez, one of the few physicians who treated me with professional respect. "When I have a complex case with multiple medications, she's the first person I consult. Her weight has nothing to do with her brain, and her brain is exceptional." Before you continue this powerful story of resilience, professional excellence, and the moment when expertise trumped prejudice, make sure to subscribe to our channel for more incredible tales about people who proved their worth through character and competence rather than appearance. The daily routine of medication administration, patient assessment, and coordination with physicians required constant vigilance and extensive knowledge that went far beyond what most people understood about nursing practice. Nursing isn't just about following doctors' orders, I would explain to new graduates who joined our unit. We're the ones who catch medication errors, notice subtle changes in patient condition, and coordinate care between multiple specialists. Our knowledge can mean the difference between life and death. The continuing education I pursued, despite the emotional toll of workplace harassment, reflected my commitment to professional excellence and my determination to be so competent that no one could question my value to the medical team. "Margaret, you've completed more continuing education hours than any nurse on staff," observed Helen Thompson, our head nurse. "Your dedication to learning and improving your skills is remarkable." The irony of working in a profession dedicated to healing while enduring daily emotional wounds from colleagues was not lost on me. But I had learned that some battles are won through persistence and performance, rather than confrontation and complaint. Every perfectly administered medication, every early detection of patient complications, and every successful coordination of complex care was proof that worth is measured by what you do, not how you look while doing it. The relationship with James Sullivan, a respiratory therapist who saw past my weight to appreciate my intelligence and kindness, provided emotional support during the most difficult periods of workplace harassment. "Maggie, those doctors are idiots if they think your weight has anything to do with your value as a nurse," he would tell me during our coffee breaks. "You're the most knowledgeable and caring medical professional in this hospital, and someday they're going to realize how lucky they are to work with you." The morning of November 15, 1974, began like any other shift, with me arriving early to review patient charts and prepare medications for the surgical unit where I had worked for 3 years. Dr. Hamilton was scheduled to perform a complex cardiac bypass surgery on a 68-year-old businessman, a procedure that would require precise coordination between the surgical team, anesthesiology, and nursing staff to ensure optimal patient outcomes. "O'Brien, try not to break any equipment today," Dr. Hamilton had sneered as he passed the nurse's station, his daily ritual of humiliation designed to establish his dominance and my subordinate status. "We can't afford to have surgery delayed because our oversized nurse can't fit between the machines." His cruel joke drew the usual laughter from his residents and interns, young doctors who had learned that mocking me was an acceptable way to curry favor with their superior. The preparation for the cardiac surgery was routine but critical, as I checked and double-checked medications, ensured all equipment was functioning properly, and coordinated with the surgical technicians who would assist during the procedure. "Everything's ready, Dr. Hamilton," I reported when he entered the pre-op area. "Patient is stable, medications are prepared, and all equipment has been tested and calibrated." His acknowledgement was grudging and minimal, as usual treating me as a necessary but distasteful part of the surgical process, rather than a valuable team member whose expertise contributed to successful outcomes. "Just stay out of the way," and try not to contaminate the sterile field with your presence," he muttered as he began his pre-surgical routine. The surgery proceeded normally for the first 2 hours, with Dr. Hamilton demonstrating the technical skill that had earned his reputation as one of Chicago's finest cardiac surgeons. But during the critical phase of connecting the bypass grafts, I noticed subtle changes in his behavior, slight tremors in his hands, brief moments of confusion about procedure steps, and a grayish pallor that suggested cardiovascular distress. "Dr. Hamilton, are you feeling all right?" I asked quietly, my concern overriding the usual protocol of not questioning the chief surgeon's condition. "You seem a bit pale, and I noticed some trembling in your hands. Perhaps you should take a moment to rest." My observation was met with immediate anger and dismissal, as he viewed my concern as insubordination rather than professional vigilance. "Mind your own business, O'Brien," he snapped without looking up from the surgical site. "I don't need medical advice from a nurse, especially one who obviously doesn't know anything about staying healthy. Focus on your job, and let me focus on mine." His rejection of my concern was typical of his attitude toward my professional input. But the warning signs I was observing were becoming more pronounced. The cardiac arrest that struck Dr. Hamilton 15 minutes later was sudden and dramatic, as he collapsed over the operating table while in the middle of suturing a critical bypass connection. "Dr. Hamilton is down," I called out, as I immediately began assessing his condition while simultaneously protecting the patient who was still under anesthesia with his chest open. The chaos that followed tested every aspect of my emergency training and clinical experience, as I had to coordinate the completion of the patient's surgery while managing the medical crisis that had incapacitated the lead surgeon. "I need Dr. Martinez from cardiology stat and get the crash cart," I ordered while beginning CPR on Dr. Hamilton. "Someone needs to take over the patient's surgery immediately." My knowledge of cardiac procedures, gained through years of assisting in surgeries and studying medical literature, allowed me to provide critical guidance to the replacement surgeon while continuing to manage Dr. Hamilton's resuscitation. "The patient needs the LAD graft completed, then closure of the pericardium," I advised Dr. Martinez as she scrubbed in. Dr. Hamilton had just started the final anastomosis when he collapsed. The successful resuscitation of Dr. Hamilton required 20 minutes of intensive cardiac life support, during which my knowledge of advanced pharmacology and cardiac protocols proved essential to his survival. "Give me 1 milligram epinephrine, followed by 150 milligram amiodarone," I directed the crash team. "His rhythm is showing VFib, and we need to cardiovert immediately." The defibrillation that restored Dr. Hamilton's heart rhythm was successful on the second attempt, but his condition remained critical as we prepared him for immediate transport to the cardiac intensive care unit. "He's stable for now, but he's going to need emergency catheterization to determine the extent of his coronary blockage," I reported to the cardiologist who had been called to manage his case. The completion of the original patient's surgery was successful under Dr. Martinez's direction, with my assistance proving crucial in coordinating the complex procedure that had been interrupted by the emergency. "Margaret, I couldn't have finished that surgery without your knowledge and guidance," Dr. Martinez told me later. "Your understanding of the procedure and the patient's condition was remarkable." The investigation into Dr. Hamilton's cardiac event revealed that he had been experiencing symptoms of coronary artery disease for months, but had ignored them due to his belief that his medical knowledge made him immune to the heart problems he treated in others. "Classic physician behavior," explained Dr. Robert Chen, the cardiologist who treated Hamilton. "Doctors are often the worst patients because they think they know better than their symptoms." The revelation that my early observations about Dr. Hamilton's condition had been accurate added credibility to my clinical assessment skills, while also highlighting his dangerous habit of dismissing nursing input as unqualified interference. Nurse O'Brien's observations were medically sound and could have prevented this crisis if they had been taken seriously, Dr. Chen noted in his report. The immediate aftermath of the emergency was both professionally vindicating and personally overwhelming. as colleagues who had dismissed and mocked me for years suddenly recognized that my clinical expertise had saved their chief surgeon's life. "Margaret, what you did today was incredible," said Dr. Jennifer Walsh, one of the surgical residents. "Your knowledge and quick thinking saved Dr. Hamilton's life and probably saved our patient's life too." The media attention that followed the incident was unexpected and uncomfortable, as local newspapers picked up the story of the nurse who had saved the chief surgeon, who had mocked her weight and questioned her competence. "Hospital nurse saves life of surgeon who ridiculed her," read the headline in the Chicago Tribune. "Overweight nurse proves expertise matters more than appearance," announced the Sun-Times. The recognition from hospital administration was swift and comprehensive, as they realized that the discrimination I had faced reflected poorly on their institutional culture and could expose them to legal liability for workplace harassment. "Nurse O'Brien, we want to apologize for any unprofessional treatment you may have experienced," said Hospital Administrator Patricia Williams. "Your actions demonstrate the kind of clinical excellence and dedication that makes St. Mary's a premier medical institution." The recovery period for Dr. Hamilton was long and humbling, as he faced the reality that his life had been saved by the nurse he had tormented, and whose medical opinions he had consistently dismissed as worthless. The triple bypass surgery he underwent revealed extensive coronary artery disease that could have killed him at any moment, making my early observations about his symptoms seem prophetic rather than presumptuous. "Margaret, I owe you my life," Dr. Hamilton said during one of my visits to his room in the cardiac unit, his voice lacking the arrogance and cruelty that had characterized our previous interactions. "I was wrong about you, and I was wrong to treat you the way I did. You saw what was happening to me when I couldn't see it myself, and you saved me despite having every reason to let me suffer the consequences of my own prejudice and ignorance." His apology was both genuine and long overdue, but it also represented a broader recognition that competence and character were not determined by physical appearance or conformity to social expectations about body size. "Dr. Hamilton, I became a nurse to help people, not to judge them or seek revenge," I replied. "Your weight, your attitude, or your treatment of me didn't matter when you needed medical care. That's what being a healthcare professional means." The changes in workplace culture that followed the incident were gradual but significant, as hospital administration implemented policies addressing weight discrimination and emphasizing the importance of clinical competence over appearance-based judgments. "We're instituting mandatory training on workplace harassment and discrimination," announced Dr. Patricia Rodriguez, the new chief of staff. "Medical excellence comes in all shapes and sizes, and our staff will be trained to recognize and respect professional competence regardless of personal characteristics." The mentoring role I began playing with young nurses who face discrimination based on appearance, background, or other personal characteristics became one of the most rewarding aspects of my career. "Your worth as a nurse is measured by your knowledge, your compassion, and your clinical skills," I would tell new graduates. "Don't let anyone convince you that you're less capable because you don't fit their narrow definition of what a healthcare professional should look like." The promotion to head nurse of the cardiac unit was both a professional recognition and an opportunity to create the kind of inclusive environment that I had wished for throughout my career. "Margaret, your clinical expertise and leadership during crisis situations make you the obvious choice for this position," explained the nursing director. "We need someone who understands that excellent patient care comes from respecting and utilizing the talents of all staff members. The weight loss that I achieved through medical treatment for previously undiagnosed thyroid and hormonal conditions vindicated my long-held belief that obesity was more complex than simple lack of willpower or self-discipline." "Margaret, your weight problems were largely due to medical conditions that went undiagnosed for years," explained Dr. Susan Martinez, the endocrinologist who treated me. "The assumption that you were just lazy or undisciplined was not only cruel, but medically inaccurate. The marriage to James Sullivan, who had supported me through years of workplace harassment and had celebrated my professional victories, represented both personal happiness and the triumph of seeing past surface appearances to appreciate inner worth. Maggie, I fell in love with your intelligence, your kindness, and your strength, James said during his wedding vows. Your weight never mattered to me, but watching you prove your worth to people who should have recognized it from the beginning made me love you even more. The children we raised, 2 adopted daughters who struggled with their own body image issues in a society obsessed with thinness, learned early that worth is measured by character rather than appearance. Mom, why were those doctors so mean to you just because you were bigger than them? Our younger daughter asked when she was old enough to understand the story. Because some people are taught to judge others by how they look instead of who they are inside, I explained. But those judgments say more about them than they do about the people they're judging. The nursing school that I helped establish for non-traditional students, including older adults, minorities, and others who faced barriers to medical education, became a model for inclusive healthcare training that emphasized competence over conformity. The O'Brien Institute for Inclusive Nursing Education provided opportunities for people who might not fit traditional molds, but had the intelligence and dedication needed for excellent patient care. The research I conducted on weight bias in healthcare settings revealed systematic discrimination that affected both healthcare workers and patients, leading to policy changes in hospitals across the country. Nurse O'Brien's work has documented how appearance-based discrimination undermines medical care and creates hostile work environments, wrote the American Nurses Association in their policy statement on workplace harassment. The speaking engagements I began accepting at medical conferences allowed me to educate healthcare professionals about the importance of looking beyond appearance to recognize and utilize clinical competence. Excellence in healthcare comes from knowledge, skill, and compassion, I would tell audiences of doctors and nurses. When we judge colleagues or patients based on appearance, we compromise our ability to provide the best possible care. The awards and recognition I received, including the American Nurses Association's highest honor for clinical excellence, were gratifying, but secondary to the knowledge that my experience had opened doors for other healthcare workers who faced discrimination based on appearance or other personal characteristics. The retirement party that St. Mary's Hospital held in my honor was attended by hundreds of colleagues, including Dr. Hamilton, who had become one of my strongest supporters and advocates for inclusive workplace policies. Margaret O'Brien taught us that heroism comes in all shapes and sizes, he said during his speech. She saved my life, but more importantly, she saved this hospital from the kind of prejudice and discrimination that would have made us less effective healers. Looking back on that November day in 1974, I understand that Dr. Hamilton's heart attack was both a medical emergency and a moral reckoning that forced everyone involved to confront their assumptions about worth, competence, and the relationship between appearance and ability. His collapse became my moment to prove that clinical expertise transcends physical appearance. The obese nurse who was mocked and dismissed by colleagues became the hero who saved the chief surgeon's life and changed hospital culture in the process. Sometimes the people others judge most harshly become the angels who rescue them from their own prejudices and limitations. The legacy of that day lives on in changed policies, educated colleagues, and the understanding that healthcare excellence comes from knowledge and compassion, rather than conformity to superficial standards. Sometimes the most important victories are won not through confrontation, but through competence, proving your worth through actions rather than arguments. The woman who was told she was too fat to be a good nurse became living proof that healing hands and brilliant minds come in all sizes, and that the measure of a healthcare professional is found in their ability to save lives, rather than in their ability to fit society's narrow definitions of acceptability.